In our previous videos, we have learned that the immune system is designed to protect us. But what happens when this protector becomes overprotective? This condition is called as hypersensitivity in immunology. Let us explore this concept in this video. Welcome to SK Biology. Hypersensitivity is an exaggerated or inappropriate immune response against an antigen that causes tissue damage and disease. Let us understand this definition with the image. When antigen is recognized by immune system, like B cells and T cells, they give exaggerated or inappropriate immune response and produces antibodies, and some immune cells like mast cell leads to production of histamine, cytokines, chemokines and other inflammatory mediators, which leads to tissue damage and disease. So, hypersensitivity is due to an overactive immune system, not due to immunodeficiency. Important point for NEET. Hypersensitivity is broadly classified into different types, mainly in two types called as immediate and delayed hypersensitivity. The immediate hypersensitivity reaction produces symptoms within minutes or hours, and this group includes type 1, type 2 and type 3 hypersensitivity. The another one is delayed hypersensitivity, which takes 24 to 72 hours, and this is represented as type 4 hypersensitivity. Let us look closely at type 1 hypersensitivity, which is commonly known as immediate allergy. Mechanism is in two steps: first exposure and re-exposure. In first exposure, IgE antibodies are produced by B cells, and these IgE antibodies then attaches to mast cell and basophils. When there is re-exposure of same antigen, it directly binds to mast cell on which IgE is already present, and this cross-linking leads to immediate mast cell degranulation. This bursting of mast cell leads to release of chemical messenger called as histamine. Histamine causes vasodilation. It leads to increased vascular permeability and smooth muscle contraction as well as mucus secretion. The well-known examples of hypersensitivity type 1 are hay fever, asthma, hives, drug allergy, food allergy, and anaphylactic shock. The important neat point is histamine is the major chemical mediator responsible for allergy symptoms. Among all hypersensitivity type 1 examples, we will discuss here one, which is anaphylaxis. It is a severe systematic type 1 hypersensitivity reaction that may be life-threatening. Symptoms of anaphylaxis is difficulty in breathing, fall in blood pressure and swelling of throat. Generally, epinephrine is used as a shock treatment, which is also called as adrenaline. The common triggers of anaphylaxis are bee sting, peanuts, and certain drugs in some patients like penicillin. Now, moving on to type 2 hypersensitivity, which is also called as cytotoxic type. In type 2 hypersensitivity, IgG and IgM antibodies play important role. They bind to these cell surface antigen. Once bound, they activate the complement system, which is a group of 30 proteins and a cascade of proteins that punches whole target cell, causing direct cell destruction or lysis. Classic example include mismatched blood transfusion reaction, hemolytic disease of newborn due to Rh factor, and autoimmune hemolytic anemia. Important neat point is ABO blood group transfusion incompatibility is the classic example. Now, next is type 3 hypersensitivity or immune complex mediated hypersensitivity. Here, the excess of soluble antigen reacting with antibodies. So, instead of being cleared out cleanly by immune system, these antigen antibody pair link up to form large structures called as immune complexes. and these complexes get deposited in tissues, frequently in the small walls of blood vessels, kidney, and joints. Once deposited, they activate the complement system, which recruits inflammatory cells, resulting in localized inflammation and tissue damage. Examples of hypersensitivity type 3 are serum sickness, rheumatoid arthritis, also called as RA, and systemic lupus erythematosus, SLE. The important need point for type 3 hypersensitivity is damage occurs due to immune complex deposition, not direct by antibody attack. Finally, let us talk about type 4 hypersensitivity. It is delayed type of hypersensitivity. Mechanism involved. Unlike type 1, 2 and 3, type 4 is mediated entirely by T lymphocytes, not by antibodies. When a sensitized T cell encounters its antigen on an antigen presenting cells, it becomes activated and releases chemical signaling molecules called as cytokines. These cytokines activates macrophages, which rush to the site of unleash enzyme that causes localized tissue damage over the course of 24 to 72 hours. Common example of hypersensitivity type 4 is contact dermatitis, and at the time of tuberculin test it shows tuberculosis granuloma formation. The important neat point is type 4 is only hypersensitivity type that is T cell mediated and antibody independent. This is quick revision of all 4 hypersensitivity types.